Thank you.
Never rock the mic with the pantyhose. It's always going to be a handheld mic. I can assure you I am Nacho Daddy. Guaranteed. I'm here all week, people. Tip your nerves. Anyway, sorry, I was in a sort of a feud. Thank you so much, everybody, for coming tonight. It's such an honor to see the luminaries from the community in our facility that we built here in downtown. And I want to thank Doug and the HEALS organization for bringing everybody together tonight, and you guys for all trekking downtown. As you can see, downtown is a different place than it was even 2 years ago. Things are changing rapidly, and we're glad to be a part of that ongoing change. I thought, unless you guys disagree, by the way, I never get dressed up like this. This is great. I normally wear a t-shirt and jeans. I feel like Vin Diesel, but short and fat, like Vin unleaded or something. I thought I'd just tell you a quick story about how this place came about, because there's all this weird press. When you work with Tony Hsieh, you get press, and the press says all kinds of stuff, and then there's all kinds of like, who are these guys, right? So I thought I'd just tell you this is what exactly happened here, and make it clear. So, ever since I was a kid, I wanted to be a doctor, right? Both my parents are from India, so we all know what it's like to have, well, not all, but some of us know what it's like to have immigrant parents. You know, it's like, you're going into medicine, what else? and so, this is how it was with my family. My dad was a primary care doc, and he was in private practice in the Central Valley of California. So it was in the glory days when you got paid fee for service, and you actually made a lot of money and got to take care of patients and all that. And then he lived through the period where all that changed, which so many of us have kind of experienced, either the after effects or the intro effects of. And it was a point where I went to him and I would say, I want to do primary care like you. And he said, don't be an idiot. You know what, I'm just not going to mince words. These bastards, they don't pay you to talk to patients. They don't pay you to develop a relationship with patients. They don't pay you to think. They pay you to do things to people. Preferably to their rectums. You know Bhupinder, your uncle, he is a GI. He spends all day playing the video games in people's buttocks. And he's driving Lexus. What am I driving? I spend all day doing disability evaluations, filling out paperwork, talking to the insurance company, getting paid nothing. I'm driving a Camry. I said, well, a Camry is really kind of a more sensible, like, shut up. So it was this kind of upbringing that, and my mom's a psychiatrist, so I would always get grounded in these like 72-hour increments, like, why is that? And I realized, okay, yeah, it makes sense. After I went to medical school, that's exactly a psychiatric hold. So when I went to medical school, all of us how many doctors here? Yeah. So we remember what it was like going into medical school. We had these grand aspirations. We were going to save the world and all that. And then the reality of care hits us. It's fragmented. It's volume driven. It's very different than what we thought we were going to go into. And so when I became a hospitalist at Stanford, for many years, I started experiencing this escalating horror of what was going on. 50% of the patients in the hospital didn't need to be there if someone was just listening to them, if someone was there to educate them, if someone was there to be there for them, right? They didn't even need to be in the hospital. We could have prevented all of that. And so much end-of-life care and all that. So I started to despair by the end. That, and they took away our house staff, which was, that was brutal. No more residents to scream at. It got ugly. And it was in that sort of era that I started making these ridiculous videos and putting them on YouTube as a way to just blow off steam. Tony Hsieh, who you guys may know as the CEO of Zappos, sort of saw these videos and said, hey, you're insane. We're doing these insane things in downtown Las Vegas. This is how it works in downtown. Like, he goes on YouTube and goes, yeah, let's get that guy to come move downtown. Because he made a video called Manhood in the Mirror, which is a parody of Michael Jackson's Man in the Mirror about testicular cancer self-exams. Because, who better than Michael Jackson to teach young people how to... Is it hot in here? I'm just kidding. So he said, look, this is what we're doing. Zappos is out in Henderson. I sold the company to Amazon for whatever $1 billion. But now I want to move it to downtown Las Vegas, down the street, to the old City Hall, because I've been studying cities, and it turns out when cities get bigger, when they double in size, they get 15% more productive per capita. Why? Because you get a bunch of people who nobody's telling what to do. They go where they're supposed to go. They serendipitously bump into each other, and all this innovation springs forth. So all these different fields are interacting with each other, and it leads to this productivity and these serendipitous interactions. So when businesses grow, they get more calcific, more bureaucratic, less innovative, because there's a hierarchy, and you end up becoming Pfizer, right? Anybody from the pharma industry? Good. So you end up becoming Pfizer. And so what he said is, well, what if we moved Zappos into the heart of downtown, and I spent $350 million of my own bucks, and actually actively curated the development of the empty lots and sort of burgeoning scene that was happening in downtown? Wouldn't that speed up this innovation and serendipity and all of that? And so he was investing in education and tech and the arts and small businesses and all of that. And I said, why are you telling me this? And he said, well, because we don't know anything about 18% of the GDP, which is healthcare. And there's no one who's crazy who wants to try to do something totally crazy. And how about that crazy person is you, because you made that ridiculous video, among other things. And so he said, quit your job. Your wife's a radiologist at Stanford, academic chest, got 2 little girls, moved to downtown to the Ogden, which is down the street. We were living in like Belmont on a hill with a view and stuff, and I'm sitting here listening to this going, And the weird thing was, once you get a sort of offer like that, how do you sleep at night when you go, I'm so miserable, I see everything's broken, and yet all I do is complain, and I can't actually try to do anything. There's a fairy godfather. I mean, people would kill to have this offer, and I'm like, well, but I have a house, and my kids are... It was dumb. So the next thing you know, we're in the Ogden with 2 little girls living in Vegas and trying to figure out what the heck to do. And that's when we started, finally, for the first time in 10 years of career, we know what it's like in clinical practice. You don't have any time to step back and look at the macroscopic picture, right? So I said, well, what's going on? We don't really focus on prevention. We don't focus on primary care. We're really good at doing things to people, not so good at doing things for people, right? So what if we just double down on primary care, spend a little more on it, take fee-for-service out of primary care, because it doesn't make sense there, because in primary care, all it does, it means you gotta see 30 or 40 patients a day just to keep the lights on, especially at the reimbursement rates in this town, right? So it's absurd. So we said, well, okay, let's make it a membership model, so flat fee, and that'll get you all you can treat access to the buffet, no co-pays. And what does that allow? Well, first of all, it takes that fee-for-service drive away. So now when you're a patient and a member of the clinic, you're our responsibility. We're going to take care of that whole population because people are looking at our results. Either insurance companies, employers, etc. They're looking at the data. So we're actually incentivized to do the right thing. The second piece is the care model in primary care is totally crazy. It's one doctor, one patient stressed out, or a PA or a nurse practitioner in this tense 10-minute relationship that it results inevitably in a referral or a prescription and out. No root causes can be investigated, right? Well, if you finance it correctly and you change the fee structure, now you can have more times, 30-minute hour visits, but then you can create a team that can actually support that doctor. So we have these guys and girls called health coaches in this facility. Those guys are drawn from the community. You screen maybe 500 people to find 2 of them. And they're entirely hired based on their ability to connect with other human beings, to sort of speak the language of the target population. So they're these folks. So for example, one of our health coaches is an EMT, but he's also a bartender at the Wynn before we hired him. And he's able to get in your freaking head in a way that us doctors who speak Latin and we're trained in a certain way, number one, we're not good at it. We don't really want to do it because we want to see, okay, what's the problem and how do we fix it, right? And so they spend the first minutes with the patient developing the relationship, looking at shopping receipts to see what you're eating, texting the patient, following up, doing that heavy lifting that the doctors can't or won't be able to do, right? And then they work in a team with the doctor. It leverages the doctor's ability to then practice at the top of their license to do that high-level medicine that they were really trained to do and what they really want to do. Not the paperwork and the nonsense and all that. By taking the fee-for-service insurance piece out, that means our notes are simply what we did with the patient and our thinking, as opposed to, 12-point review of systems is negative, self-diagnosis above, trying to bill insurance. We don't do that. So it opens up the care to be just that, care. Then you throw a licensed clinical social worker in the mix who does the behavioral health stuff, who recognizes mental health issues and can focus on those. And that takes another element into it. It's a true patient-centered medical home, sort of rebuilt from scratch. Throw a nurse in there, a really cool ops coordinator, and you have a team that every morning they get together in a huddle room back there. There's no private physician's offices, which at first creeped me out, because how was I going to stash all my stuff, right? But they all get together in this common room, and they go through every patient who's coming in that day, and then they go through patients that they've identified in our own electronic health record that we're worried about. We've assigned a worry score, 0 to 10. How worried are we they're going to get admitted in the next week? And we prophylactically come up with a plan. How do we manage those guys? Keep them out of the hospital, keep them out of trouble. Health coach A, call up Mrs. Witherspoon and tell her to stop putting salt in Mr. Witherspoon's food, because that's why he keeps ending up in urgent care with swollen legs and short of breath. So it's that kind of approach, managing the whole population. When you take the widgets off the line, fee-for-service out of it, you can actually do that. Now, this is not going to work in certain specialties that may not work in the hospital. It works great in primary care. And if you get the primary care piece right, the rest of the piece, that means you guys are now getting referrals that actually make sense from a doctor who actually cares to hear your opinion and communicate with you. And in fact, we preferentially refer to specialists who kind of get our model and say, you know what, these guys actually want to know what we're doing, they want to be partners in the care, they want to follow up, that sort of thing, right? So it's a very different approach. You glue it together with an electronic health record that was built from scratch to support a non-fee-for-service model. So it's not a glorified insurance billing platform, it's actually a care vehicle with task management and that sort of thing. Population health engine that identifies people out of spec for hemoglobin A1C, diabetic control, etc., things like that. We can then target those guys with communications and get them in. You guys have seen the yoga studio. The hardware of the clinic kind of supports the model. So classes on yoga, meditation, nutrition taught by the staff. The doctor teaches a cardio class. The licensed clinical social worker does meditation. We have cooking classes in our demonstration kitchen over there taught by the health coaches. And the idea is, again, empower people to be partners in their care in a system that's so fragmented where the patient is ultimately the one that suffers and the doctors suffer. We're miserable, right? It's very hard. So that's the long-winded way to explain what Turntable Health does. The way that you pay for it, because that's the bottom line, how do you actually plug this model into the existing sort of insurance system? There's 3 ways, right? You can pay for it out of pocket with a credit card on our website, and we never touch your money because we don't want to. Just auto-debited from your credit card, and you're a member, and there's nothing else you need to pay. We pass on wholesale lab prices to patients who want that, who have high deductible plans, to help them with that. Or your employer can purchase the membership or some portion of it for you. The 3rd way is partner with a health plan. Let them pay us a capitated fee, a per patient per month rate, and we'll take care of their patients in return, promising outcomes, HEDIS scores, patient satisfaction, all those other things. So our initial data shows our patient satisfaction scores. The way we measure them, because Press Ganey and all this nonsense that doctors use to measure satisfaction, it's brutal, right? You give a patient Vicodin, suddenly your Press Ganey scores go through the roof. What does it do to outcomes for the patient? It's bad. So all we do is ask a very simple question. Would you recommend, how likely on a scale of 0 to 10 would you recommend this clinic to your family and friends? And our average score over our 8 months that we've been open is 90+%. So that's really hard to do. Kaiser's by benchmark reference is 40%. So, and that's pretty good for the healthcare space. It's hard. By the way, like Cox Cable, what do you guys think? Like -15?
Do not use Cox. You have no choice. But
so that we have data showing a 12% net reduction in spend in a sick population. So there's outcomes data associated with this. Long story short, we are really excited to be a part of the Las Vegas community. That you guys are here means that we have more people we can work with, more people we can rely upon to take care of our patients when they're out of our walls, to understand what our culture is, so that when we call you and say, hey, how did Mr. Williams do, you know that we really actually want to hear what you think and spend the time to actually help this patient get better because we're motivated to do it. Not that other primary care physicians are not good people motivated correctly, it's just they're in a very tough system. So that's pretty much the story, more or less. We've been open 8 months. We'd love you to tell your friends about us and your patients about us. And any way we can help you and work with you, we would love to. So that's pretty much it. If you guys have any questions, I'm happy to lie. Yeah.
So, at what point do you kind of max out on your capacity of patients, and how close are you to that?
So the question is, what's our capacity? Like, when do we max out? And the answer simply is, it depends on the acuity of the patient population, but typically our per patient doctor ratio is something like anywhere between 600 to a doctor for very sick patients. But in this population, more like 1,200 to 1,500 per doctor, leveraging 4 health coaches per doctor. So that allows 30-minute visits with a doctor kind of going from room to room, the health coach kind of doing heavy lifting and running interference and actually doing paperwork, things like that. So it works very well. So probably 1,500 would be the upper limit of what a doctor. And right now we're at about 1,000 and some change in a few months. And so we're happy with that. Yes?
What's your fee?
Our fee retail for adults is $80 a month, for kids is $60 a month. There's discounts for groups, discounts for obviously health plans and volume and businesses and things like that.
Have you had any, excuse me, have you had any success with the insurance companies providing you fees and that kind of thing?
So we have our friends from Nevada Health Co-op here who were the first to use us in their model. And so they have a plan called Neighborhood on the exchange this past year, where they offer, within the premium is full access to us. So we've got a good number of patients from them that have been getting care for the first time in a long time because their exchange patients are getting federal subsidies. It's been tremendous. Yeah, so we're hoping that continues to grow. Other thoughts or questions?
So how many physicians do you guys have now?
Right now we have 2 family practitioners and some health coaches, the social worker and the nurse innovator person.
Close to 1,000 patients?
Around 1,000, yeah. So we need to grow more because I think this facility can probably support 3,000 to 5,000 patients ultimately if we hire up.
So all Zappos employees, do you know?
So Zappos, because Tony is the CEO of Zappos and also an investor in this clinic, we have to go through a formal process with Zappos that takes a long time. So at some point I'll be able to tell you an answer to that. Publicly traded company. Yeah. Other thoughts or questions? Anyone want to throw anything at me?
Yeah. Do you write your own music videos?
What's that?
Do you write your own videos?
Do I write my own videos?
Breaking Bad.
That's a break. Yeah, I write most of the videos. Sometimes I partner up with a pediatrician called Dr. Harry, who I went to medical school with, and we try to poke fun at the medical system and different things like that. So it's fun. If you guys check it out, it's zeoggmd.com. It's going to get me arrested at some point. Let's get it out there, get the parole officer on the line, the whole thing. Cool. Thank you so much, you guys, for coming. It really means a lot to us. Appreciate it.